Phaba Palewardena, who is the Deputy Director General of Health Services in Sri Lanka. Very good morning to you, Dr. Phaba.
Good morning.
And lovely to have you on the program, and thank you for taking the time out. As you can see, I come armed with the necessary implements of the day. It used to be tea, but actually now we've got the other thing going. We've got the hand sanitizer, and I hope that everybody, that the message is coming out to the public at large, that you really must be clean on the go. You know, wash your hands on the go the whole time. And this bottle of goodies is here everywhere for us to use. So, Dr. Phaba, what do you say is the situation? Are you happy with the situation? Is it to your satisfaction?
Yeah. But today's situation, of course, I'm quite happy as an epidemiologist.
Right.
So my background, I'm an epidemiologist, and I have been working as the chief epidemiologist for a long time, managing several outbreaks in the country. So what I see today, the picture is, of course, it's well under control, I should say. And of course, the measures what we have taken so far has been working quite effectively, but that's what I see right now. And so we are, for a day of, yesterday of course we did not have a single case.
That's actually good, in a way, good news, isn't it?
It's a good news.
So what's the tally? I've got it down here as 102 cases, confirmed cases.
Yes, confirmed cases.
0 casualties.
Zero casualties,
you know,
up to now, yeah.
deceased, and 3
discharged. Yeah.
Okay, so that's very good, isn't it?
That's quite good.
But
Yeah.
I like my statistics, and I'm looking at this here. Last morning at 7 o'clock, when I went on the global figure, there were confirmed cases around the world that has been reported by about 184 countries, 379,375.
Yes.
This morning, in the last few minutes, about 8 minutes ago to be precise, I had a look again. It was 474,420, which is a substantial increase.
Yeah.
I know that all countries don't report at the same time and so on, but it works out.
That is how it happens.
Yes.
And also maybe today, now morning, we may see a different figure.
Yes, and
well.
the global deceased figure this morning is 21,257. Whereas last morning it was 16,509. So in the space of sort of 24 hours, because all the reports have come together. What do you say we should do more? Is there much more to be done now?
So what we have started, and the practices what we are sort of doing and continuing is quite, I should say, sort of, well and adapted, and also it's really working. I think need to move in the sense, like we'll take one by one. So what kind of things that we expect from the people. So we were talking about this social distancing. I mean, that is
Indeed.
So
that's like 1 meter away.
1 meter away. So that is the one that we need to highlight again and again.
Right.
So then, as you ask me whether we should do more, of course we need to practice that.
Right.
So we should be adhere to that.
The fish market, though, was a disaster.
So this could be happen. This could not happen in a way that we wanted in some places like fish market. So that is those are the areas where we need to strengthen.
Also, around our block here, where the Maharaja head office is, and you know, where we are in the studio, there's a supermarket sort of at the back of us. And because we can't mention names, but anyway, this is a supermarket behind us. And 2 days ago, it was the queue was from the back, and it was all around this block. And the queue was very good. You know, they had the social distancing. But when you went inside,
it was not.
It was chaos.
It was chaos. So those are the areas where we need to strengthen. And yesterday they took a decision at the national level by the government to distribute the food stuff. So the food parcels to be made at a central point and to be delivered at the doorstep.
Right.
So that, of course, now it's happening right now.
Is it?
Yeah. So, and they have started delivering the needs.
So how do they get the order? How do they know how much I want?
Basically, they may prepare general pack.
A pack.
Yeah, pack, and people can buy at the doorstep. So that is that is being already implemented and in some areas. Yeah.
Indeed, that's good.
Yeah.
And on Newsline Live, as of course, we encourage you to send us your questions, and you can do that on 0772 300 305. Harshad, the police is and the control room's hot on the ball. They've got it on the screen there, and I'd just like to say our control room and to our cameramen and so on. Thank you very much for being so brave to turn up to work in spite of the challenging circumstances. To everybody, to all our editors, everybody in the control room that mans all those buttons, goodness knows what they do, but they do something. Those buttons, I mean, and we have a super team. So thank you very much for that, Shehan and Hashina and so on. Thank you, excellent work, and we are deeply grateful to that. And of course,
don't forget sanitizing their hands frequently.
I'm sure they are. And look, you must sanitize on the go, on the go. Keep your distance, keep safe. Look, I'm doing this now. You're supposed to sing happy birthday, but you can sing, I want to save my country. I want to save my country. That could be the mantra. Now then, Dr. Papa, do you want some?
Yeah, I also don't mind having
Right, there you go. There you go. So you see, we're doing that here. You must do that. People sometimes say that whilst we're using this, we don't, that people can't find it. I know it's a bit of a problem.
Finding the stuff.
Finding the stuff. But
so then soap and water is good enough.
Soap and water is good enough. Okay.
Yeah. Wherever you have water and soap, so that will be the best way of cleaning your hands.
Very important, isn't it? Water. Water is actually the elixir of life.
Yeah.
And so, therefore, when we look at parts of our country where there are droughts and where there is non-availability of water, we are forced to remember again and again and again that the resources of our nation needs to be utilized very well indeed. Because if it is not, then when in times of this type of crisis, the problem is even greater, exaggerated. Dr. Papa, are you happy with the budget allocation to your ministry, to your work?
Yes, so the thing is, the government at this moment is quite active on looking at the necessities of these health ministry.
Yeah.
And at the same time, we do get some donations from different organizations, from different international organizations, and also the national.
Can we rely on them? I mean, isn't it better to have our own and consider the international aid as a bonus?
Yeah, of course. It is, of course. We consider it as a bonus.
Yeah.
And I think it's good to have, so this is the time to get our, all these hospitals updated.
Indeed.
And all these surveillance mechanisms updated. So, which is, of course, a good chance. And I think we need to
You're saying that with great glee, because these opportunities don't present themselves every day.
Yeah. So this is a good opportunity, I should say. And I think nobody could say that, you have enough funding and all. Of course, the finance ministry should answer that question. How much money that they could give to the health ministry.
When you are
asking,
when you are the deputy director of health services, how much of the finance part impacts on your job?
Okay, when we need to do preparatory work, for example, on one side strengthening hospitals, the capacity, so the number of beds, the number of ICU beds, number of high dependency, and also the equipments what is needed for all these preparatory work. So that needs a lot of money. Laboratories.
When you just now before we started, I asked you about IDH. You told me that actually now IDH is not 5 beds, it's now 10 ICU beds. And not everybody who has got the confirmed virus needs to have ICU treatment. So that is essential to understand that. But in case it's needed, Then now ICU IDH has got 10. How much did it cost? What was to you know what I'm saying? From 5 to 10, what do you think it cost?
I can't tell you the
No, you
exact
can't.
total number of, I mean, what is the financial need for
What
it.
about the staff? Do you have enough staff?
Yes.
The trained ICU staff?
Trained ICU staff. Of course, it's IDH is the new name is National Institute of Infectious Diseases, and that is the institution for infectious diseases management.
Right.
So, and we have a very good trained staff at that hospital. And that hospital is the training center for many other hospitals on infectious diseases.
Right.
I mean, that
So
continuous training is
that's the
undergoing,
center.
it is done by them. And that is, of course, the core for the management of infectious diseases, the treatment of patients, when it comes to treatment of patients. So the nearby hospitals have been now prepared for this action. So whenever we need, if we need more patients to be sent, or we need more beds, we say we have more patients. And then we need the other hospitals also to be ready, and already the nearest hospital, Mullaria, is also ready.
How many beds do you think they have?
Oh, there also we can have more than 100 beds.
Beds. And how many ICU beds?
ICUs, of course, it's few, less than 5 or something like that.
I think
Around 5,
It's about, well, let's
Around
say it's
5.
5.
It's
I
5,
thought it was 3. And then we have another place up in Polonnaruwa, right?
Polonnaruwa, Velikanda, we have started. And also, in every hospital, we have ICU beds.
Of course, yes.
Of course.
But that is,
not many.
You can't put infectious people in there.
No. Now we have already identified number of hospitals around the country, around 30 hospitals.
Right.
So they all are getting ready with the ICUs and the wards.
That's what I was looking for.
Yeah.
You are in a state of preparedness.
Preparing.
Okay. And how do you find these people, unfortunately, who have sort of confirmed cases, that they're confirmed with the virus. How do you find their state of mind? Are they totally upset? Have you got staff to cope with that as well?
Yeah, for the time being, sort of we are managing with the available staff in every hospital, because the routine workload has also been postponed to a certain extent, in, like, for example, like elective surgeries, and also some clinics, and also the operations and things like that have been postponed to a certain extent, and the emergency work is being attended by the hospitals right now. So therefore, now most of the hospitals are ready. As I mentioned, 30 hospitals are ready by now to cater if we get more and more patients to treat. Yeah.
I'm reading through all the questions that are coming in. Most of them are to do with the social distancing and urging the government to do more in terms of delivery, so that lorries or these trucks can come to strategic locations near a cluster of homes, which would then do away with the scenes within various supermarkets and the fish market, for example, and so on.
Then we can reduce the crowd in those places.
How essential is it to stop people from traveling from district to district? I know that there are a lot of people who are working in Colombo who are from outstation.
From outstations, But that, of course, it is based on the information, the epidemiological information of the cases. So right now we have about more than 100 patients have been identified. In most of these patients were from Colombo, Gampa, and Kalutara. So that's why we wanted to contain that area by having curfew.
Right.
And also certain operations, of course, we wanted to minimize within those districts, and we didn't want to mix up people from one district to another. So these are strategies that we need to use during an outbreak, as we see most of the patients are from those areas. So that we may have to continue depending on the, like now we talk about these 14 days where we wanted to have everybody quarantined for 14 days, assuming that the incubation period is around 14 days. So that is, we give the maximum duration of, we take the maximum duration of the incubation period, and we wanted to be quarantine people at home or at the quarantine stations for 14 days.
Yeah.
So that's why, we are trying to minimize the movement between these districts from the rest of the country.
Yeah.
And having this kind of a containment for a couple of days. So we may continue this, looking at the case load and etc. and etc.
Right.
So yeah. So with the case load of also, that also I have to say, now you asked about the hospitals and all.
Yeah.
So whether we need more and more hospitals.
Yeah.
That also now, by looking at the case load for last 2 weeks, what we have experienced.
Yeah.
So for a day, the maximum number of cases we got was around 13. Right. So that was that was the number that we used to get, around 10, from 5 to 15, of course, no cases yesterday.
Yeah.
Right? So, if we can maintain at this level, we may not need many beds and many ICUs and many hospitals.
We can't gamble on that.
Yeah, no, we cannot be gamble on that, but we need to try and maintain that status.
Yeah.
Of course.
Yeah.
By having all these social distancing.
Indeed. I've got some data here that says, for example, Colombo Central, that the total cases was 329, home quarantine was 316, and so on.
This is suspected.
Yes, this is suspected. These are figures from
the
epidemiology,
from the police. From the police.
Yes, and they probably got it from for example, in Mount Lavinia, total cases 1,069. Home quarantine is 1,066.
Yes.
So these are sort of suspected cases.
Suspected in the sense, maybe they have come from different countries, or they may have had contacts with the people who have come from those countries.
Dr. Papa, I want to ask you this. We've got IDH, we've got not too far away, we've got Mullaria, and certainly far away, we've got Polonnaruwa.
Velikanda.
Okay. Then we have some people in quarantine in Batticaloa, that was used as a centre there. Would it not have been better to have it all in the one place?
So it depends on the facilities we have at one point. So whether we can keep more than, we have more than 3,800 people quarantined. So do we have facilities at one place to keep all these 3,800 or 4,000 people at a given time? So which is not very practical. So we had to find places. People did not want, some people did not want them to come near to their places.
That cannot be a consideration.
Yeah. So and then we had to say, and that was a kind of, I should say, a lot of restrictions have been seen by many people in the country, and also for the management easiness, and also having bigger places.
Surely the management easiness
is, which we need to consider a lot.
Of course, but
which we need to consider.
When you take and this is why it's so important to have good roads, road transportation. If you're just looking at that only, then
that is not the only thing I should say.
No, I know. But if you're just looking at that on its own, just that aspect, then the choice of Batticaloa, which is at least 6 hours by coach away from Katunayake Airport, is that argument is not tenable. But if they had diverted the aircraft to Maktal Airport, which is empty, it is isolated, it is an international standard airport, it has got hangars, it has got various facilities there. And my mind goes back to 1983, when during, soon after the riots, perfectly healthy people, apart from the fact that they're utterly traumatized because of the burnt buildings and whatever, their homes and so on, were housed temporarily in the hangars at Ratmalana Airport. Now, why couldn't we do this at Maktal Airport?
But these decisions had to be taken within a short period of time. That was also another reason. We need to prepare for people to live, and it should be a kind of better place for people to live. And also at the same time, sort of the facilities we had at one given place, the number of rooms, the number of beds, the number of people could be stay So all these factors also need to be considered, and also if if you know where we have these isolation units, it's all around the country. It's not only in Bati. So we have identified some places in Wanni, and also some places in Diatalav, some places in I should say Palali, because like, we had to. I don't know how. I don't know how to explain these things, but the places where we could utilize within a short period of time, having necessary facilities. So all these things we had to consider.
Right.
So this was a decision taken by a group of people. It's not only by
were there doctors and epidemiologists?
Epidemiologists, the doctors, the forces, they were doing the supportive role in this particular activity. So then, when large number of people are coming at the same time, so with several flights were coming and huge number of people were arriving at one given time. So within a couple of days, because they were also rushing. So that was also has happened. No, we had to understand those things also. They all wanted to come to Sri Lanka. Many Sri Lankans who are working in different countries. So that was also another reason. So we need to take them also into a quarantine institution. So all these factors we had to consider, and then of course we identified those places. It is not, of course, it's a little far from Colombo that we need to, but at the same time, those people, I know, you are saying why it is in Batticaloa.
No, I don't really mind it being in Batticaloa or anywhere. All I'm thinking about is we've got an airport, we've got fabulous roads there. I mean, today, from Katunayake, if you want to get to Mattala using the highway exclusively, you can get there in approximately 3 hours, and you won't be breaking the speed limit. I've done it, so I know. And Mattala Airport is also in the middle of nowhere, in the sense there aren't houses right around it, so it's easy to control. If you want to shut it off, you put a barrier at the other end, about a kilometer or two away, and then you're isolated. And so therefore, I was wondering. My mind, why we couldn't use that anymore.
No, if we need more and more places, of course, we would think of those areas as well.
Good. What do you foresee the challenges? For example, the other figure that I didn't mention was the fact that yesterday it was 2,036 people, curfew breakers, the violators, and now. Yesterday, last night, it was 3,700. So, why is that figure's going up? It means people aren't listening. What do you have to say to those people?
Yeah. So, these things can happen always. I think the great majority of people were staying at home, I should say.
Yeah.
And of course, I appreciate it. So, following guidelines and listening to us and staying at home and and keep away from others. So all these social distancing measures have been taken place at many places, I should say. I appreciate that. But at the same time, as you said, there's some of these curfew breakers, of course, who were hanging around on roads and various places. Of course, there is a percentage of people who always try to do this kind of work. But I should say this should not happen. The police has taken action, so that is that they have observed. So to prevent them getting into groups, and if any one of them had the disease, of course there are higher chances of spreading the infection. So fortunately, these people have been captured by the police and they have advised and then send them off. So that always happens, but I don't agree with that in the sense that if people try to break the curfew rules and walking around on the roads and trying to do various things. I think I don't know whether this information, what we are talking here, whether they can reach this information, if they can listen to this information.
Believe
they
me,
should not.
They can, because our network's reach is far and wide.
And then they should not.
And do you now lots of questions about these people who about the delivery of groceries. Do we have are we ready yet with a hotline number?
I don't have that number right now. The
Okay.
government will announce that.
Okay.
The government very soon.
Right.
And in fact, there was the mechanism, of course, what we discussed yesterday, that to deliver these, no, to identify the supermarkets and the places where they could give food and for them to parcel, and also the mechanism what we have in the ground level through the Grama Niladhari and through Pradeshia Lekam. So we have the government agent, and they will devise a mechanism within their areas to deliver these food parcels to people at the doorstep. So that is the arrangement. Of course, the hotlines and all will be announced by the government very soon.
So that's imminently to be announced imminently. Let's see. Various people say. I want to mention. There's some people saying that, like the Indian police, curfew breakers should be caned. Corporal punishment for them. But yesterday we played the clip in Latin, so our police are acting far better in that way, and with much more restraint and understanding, and the people of Sri Lanka must I think appreciate that aspect of that. The one other question I want to give you just before we close is, how are the plans going to deploy the use of the KDU facility for ICU?
Yeah. Yes, so this is also another hospital where we have a lot of facilities, as you mentioned, sort of with many ICU beds. And
about 60 beds in one location.
Yeah. So, and the government has considered about KDU, the Ministry of Health had several discussions about this, and also they have had discussions with the KDU staff as well. And so Health Ministry is planning to say, at any moment, sort of we need more and more beds and more ICU facilities. Of course, we would think of getting the KDU.
So it's on standby?
Yeah, it's on standby, yeah.
Right. And you are at the moment, as we speak, you are gathering this necessary staff to
establish these isolation facilities.
Right. Yeah. Okay. So, what do you want us, the public, to do? What would you like the public to do?
Public, of course, we are always talking about this social distancing and be at home. So not to gather in groups, and not even in small groups, because and I have to say one thing. I mean, right now, as you said, then where we are. So if I tell you about the disease, of course, there is no community transmission right now.
Right.
So we have not observed. So we have observed very close clusters among patients. I mean, few small clusters have been detected. So therefore, we don't have to worry about that too much. People should not be panic about this disease, the COVID-19.
Right.
So don't get panic, but you need to take precautions. That is why we are advising you to have the social distancing in the sense, so to keep away from others, stay at home, don't gather even in small groups, and then and listen to what should I say, the media, or what the main channels, main channels, and
what do you mean main channels? There's only one main channel. It's Newsfirst.
Right? Okay, that's fine.
Well, Newsfirst, we brings you the news as and when it happens.
So and practice what they advise.
And hand sanitize. You need to do that. Well, Dr. Prabha Paliwardena, thank you very much indeed, and I'll leave that with you. That's the way it was on Newsline Live this morning. Take care, keep your distance, keep safe, and remember, in all of this, we are all together as one. Take care. God bless.
Newsfirst, Newsline with Faraz Shauketaly.